The back of the thigh. The back of the thigh extends from the gluteal fold above to the back of the knee below. The skin over the back of the thigh is supplied by posterior cutaneous nerve of the thigh, which runs downwards in the midline on the back of the thigh, deep to the fascia lata and superficially to the long head of the biceps femoris. Another is the cutaneous branches of the obturator nerve, which supply the medial part of the back of the thigh in the upper part. Now there is medial branches of the anterior cutaneous nerve of the thigh, which supply the medial part of the back of the thigh in the lower part. Now lateral cutaneous nerve of the thigh send twigs to the posterior aspect of the thigh in the upper part. So these were the cutaneous innervations of the back of thigh. Now the posterior compartment of the thigh is also called flexor compartment. It is completely separated from the anterior compartment by the lateral intermuscular septum. But it is incompletely separated from the medial compartment by ill-defined posterior intermuscular septum. Now the muscles of the posterior compartment are hamstring muscles and short head of biceps femoris. Nerve of the posterior compartment is the sciatic nerve, and arteries is from the arterial anastomosis on the back of the thigh. Now muscles of the back of thigh, these are known as hamstring muscles. Ham means back of thigh. The hamstring muscles are semitendinosus, semimembranosus, biceps femoris, and ischial head of adductor magnus. The characteristic features of the muscles of back of thigh or hamstring muscles are: these all arise from the ischial tuberosity. These all are inserted into one of the bones of the legs, and all are supplied by the tibial part of the sciatic nerve. And last is, all are flexors of the knee and extensors of the hip joint. Now biceps femoris, it consists of two heads, long head and short head. Long head arises from the lower medial part of the upper quadrilateral area of the ischial tuberosity. Short head arises from the lower part of the lateral lip of the linea aspera and upper 2/3 of lateral supracondylal line. The two heads unite in the lower third of the thigh to form a conjoint tendon, which slopes downwards and laterally to be inserted onto the head of the fibula. The nerve supply, long head of the biceps femoris, is supplied by the tibial part of the sciatic nerve, and the short head is supplied by the common peroneal part of the sciatic nerve. Now after this we have another muscle, that is the semitendinosus. Its name signifies that it is lower half is tendinous. It arises along with the long head of the biceps femoris from the lower medial part of the upper quadrilateral area of the ischial tuberosity. In the lower part of the back of the thigh, it diverges medially and passes behind the medial condyle of femur, and then curves downwards and forwards to be inserted into the upper part of the medial surface of the tibia behind the insertion of sartorius and gracilis. It is supplied by the tibial part of the sciatic nerve. Another is the semimembranosus. Another muscle is the semimembranosus. This is broad muscle which is half membranous. It arises from the upper lateral part of the quadrilateral area of the ischial tuberosity. The fleshy part converges below to form a tendon which is inserted into a horizontal groove on the back of the medial condyle of the tibia. The tendon of insertion of the semimembranosus gives a fibrous band that extends upwards and laterally behind the posterior aspect of the capsule of the knee joint to form oblique popliteal ligament of the knee. Now this oblique popliteal ligament is actually an extension of the tendon of semimembranosus. A fibrous expansion extends downwards, another fiber expansion extends downwards and laterally across the fascia covering the popliteus to be attached to the soleal line. Now nerve supply, it is supplied by the tibial part of the sciatic nerve. Another muscle is the ischial head of the adductor magnus. It arises from the inferolateral part of the ischial tuberosity. It descends almost vertically downwards to be inserted on the adductor tubercle. So that is the insertion of adductor magnus. It is also supplied by the tibial part of the sciatic nerve. Now action of hamstring muscles, they are the chief flexors of the knee joint and weak extensors of the hip joint. The hamstring muscles are the hip extensors during walking on a flat ground when the gluteus maximus exercise minimal activity. Now another important thing is the sciatic nerve. The sciatic nerve is the thickest nerve in the body. It is about 1.5 to 2 centimeters wide at the beginning. It arises from the sacral plexus in the pelvis and consists of two parts, tibial part and common peroneal part. The tibial part is formed by the ventral divisions of the anterior primary rami of L4, L5, S1, S2 and S3. The common peroneal part is formed by the dorsal divisions of the anterior primary rami of L4, L5, S1 and S2. The two parts are usually enclosed in a common sheath of connective tissue. It begins in the pelvis and terminates at or just above the superior angle of the popliteal fossa by dividing into tibial and common peroneal parts. It divides into tibial and common peroneal parts. In the pelvis, it lies in front of the piriformis muscle under cover of its fascia. It enters the gluteal region through the greater sciatic foramen below the piriformis. It turns downwards with a slight lateral convexity and passes between the ischial tuberosity and greater trochanter. It enters the back of the thigh at the lower border of the gluteus maximus and runs vertically downwards just above or at the superior angle of the popliteal fossa at the junction of upper 2/3 and the lower 1/3 of the back of the thigh. It divides into two terminal branches, that is the tibial nerve and common peroneal nerve. Now its relationships. From above downwards, the sciatic nerve is related to body of ischium, that are the deep relations. Deep relations are body of ischium, tendon of obturator internus with two gemmelli, gemellus superior and gemellus inferior, quadratus femoris, and adductor magnus. So these are the deep relationships of the sciatic nerve. Now superficial relationships, from above downwards, it is related to gluteus maximus and long head of biceps femoris. Now this sciatic nerve is accessible on the back of the thigh only in the angle between the gluteus maximus and the long head of the biceps femoris. Its branches are, it gives articular branches to the hip joint, muscular branches to the hamstring muscles arise in the lower part of the gluteal region, muscular branch to the short head of biceps femoris arise in the lower part of thigh from the lateral side of the nerve. Now, what is arterial anastomosis on the back of the thigh? There is longitudinal arterial anastomosis, trochanteric arterial anastomosis, and cruciate arterial anastomosis. The longitudinal arterial anastomosis is the main arterial supply of the back of the thigh. It is derived from the perforating branches of the profunda femoris artery. The perforating arteries pierce the adductor magnus and divide into ascending and descending branches. Close to the posterior aspect of the insertion of adductor magnus, a chain of longitudinal arterial anastomosis is formed by the ascending and descending branches of four perforating arteries. Now, trochanteric anastomosis. Trochanteric anastomosis is situated in the trochanteric fossa. It is formed by the ascending branch of the medial circumflex femoral artery, ascending branch of the lateral circumflex femoral artery, descending branch of the inferior gluteal artery, and descending branch of the superior gluteal artery. So that is the trochanteric anastomosis. Another is the cruciate anastomosis. It is formed by the transverse branch of the medial circumflex femoral artery, transverse branch of the lateral circumflex femoral artery, ascending branch of the first perforating artery, and descending branch of the inferior gluteal artery. So these anastomoses are very important to supply whole of the thigh. Another important topic is the popliteal fossa. Popliteal fossa is a diamond-shaped hollow on the back of the knee joint. It becomes prominent when the knee is flexed. The fossa is an important anatomical region because it provides passage for main vessels and nerves from the thigh to the leg. Now, its boundaries. Superomedially, it is bounded by the semitendinosus and semimembranosus. Superolaterally, it is bounded by the biceps femoris. Infерomedially, it is bounded by the lateral head of the gastrocnemius, supplemented by the plantaris, and medial head of the gastrocnemius. Laterally, inferolaterally, it is bounded by the lateral head of the gastrocnemius, supplemented by the plantaris. Now, the floor of the popliteal fossa, it is formed from above downwards by the popliteal surface of the femur, the capsule of the knee joint, and oblique popliteal ligament, the popliteal fascia covering the popliteus muscle. The roof or posterior wall is formed from the strong popliteal fascia, short saphenous vein, short saphenous vein forms the roof. 3 cutaneous nerves that are the terminal part of the posterior cutaneous nerve of the thigh and sural communicating nerve. The roof is pierced by all these structures except the posterior division of medial cutaneous nerve of thigh. So this forms the roof of the popliteal fossa. Now contents of the popliteal fossa. Popliteal fossa consists of popliteal artery and its branches, popliteal vein with its tributaries, tibial nerve and its branches, common peroneal nerve and its branches. Besides, we have popliteal lymph nodes and popliteal pad of fat. In addition to the above mentioned structures, the popliteal fossa also contains posterior cutaneous nerve of the thigh, its terminal part, descending genicular branch of the obturator nerve, and terminal part of the short saphenous nerve. Now relationships of these structures in the popliteal fossa. The popliteal artery is crossed superficially by the popliteal vein from lateral to medial side. From lateral to medial side, which in turn is crossed superficially by the tibial nerve from lateral to the medial side. As a result, the relative relationship of these structures differs in the upper, middle and lower parts of the fossa. In the upper part of the fossa, from the lateral to medial side, there is nerve, vein and artery. In the middle part of the fossa, from superficial to deep, we have nerve, vein and artery. And in the lower part of the fossa, from lateral to medial side, we have artery, vein and nerve. So this is important thing which will be asked in your exam, the relationship of the nerves and vessels in the popliteal fossa. Now this popliteal artery, it is a continuation of the femoral artery. It begins at the adductor hiatus, that is a hiatus opening in the adductor magnus at the junction of the middle 1/3 and lower 1/3 of the thigh. It crosses the floor of the popliteal fossa from the medial to the lateral side to reach the lower border of the popliteus, where it terminates by dividing into anterior tibial and posterior tibial arteries. So it divides into anterior tibial and posterior tibial arteries. Now relationships of the popliteal artery. Anteriorly we have floor of the popliteal fossa, that is the popliteal surface of femur, posterior aspect of the knee joint and fascia covering the popliteus muscle. And posterior relationship is the popliteal vein, tibial nerve, facial roof, superficial fascia and skin. Now branches of the popliteal artery. They are divided into three groups: cutaneous, muscular and articular. Cutaneous branches pierce the roof and supply the overlying skin. Muscular branches are large and several in number. The upper branches supply adductor magnus and hamstring muscles. One or two of them anastomose with the fourth perforating artery. The lower muscular branch supply the gastrocnemius and soleus. Now genicular or articular branches. They are 5 in number and supply the knee joint. Superior medial and lateral genicular arteries, inferior medial and lateral genicular arteries and middle genicular artery. The superior, medial and lateral genicular arteries, they wind around the corresponding side of the femur immediately above the corresponding femoral condyles and take part in the formation of genicular anastomosis. Inferior, medial and lateral genicular arteries wind around the corresponding tibial condyles and pass deep to the corresponding collateral ligaments of the knee joint to take part in the formation of genicular anastomosis. Now this middle genicular artery, it pierces the oblique popliteal ligament of the knee to supply the cruciate ligaments and synovial membranes of the knee. Now what is this genicular anastomosis? This genicular anastomosis, as the name implies, that it is an anastomosis around the knee joint. It takes as follows: superior medial genicular artery anastomosis with the descending genicular branch of the femoral artery, and inferior medial genicular artery. Inferior medial genicular artery anastomosis with the superior medial genicular artery and the saphenous artery. Now, superolateral genicular artery anastomosis with the descending branch of the lateral circumflex femoral artery and inferior lateral genicular artery. Now, this inferior lateral genicular artery anastomosis with the superior lateral genicular artery, anterior and posterior recurrent branches of the anterior tibial artery and circumflex femoral branch of the posterior tibial artery. So that is the genicular anastomosis. Now this tibial nerve. Tibial nerve is the largest terminal branch of the sciatic nerve. It extends vertically downwards from the superior angle to the inferior angle of the popliteal fossa. It crosses popliteal artery superficially from the lateral to the medial side, with the popliteal vein intervening between the artery and the nerve. Now, branches of the tibial nerve. Muscular branches supply gastrocnemius, both heads of the gastrocnemius, soleus, plantaris and popliteus. All the muscular branches of the tibial nerve arise from its lateral side, except the nerve to the medial head of the gastrocnemius, which arises from the medial side. Therefore, the lateral side of the tibial nerve is termed dangerous side and medial side as the safe side. The nerve to popliteus crosses superficially to the popliteal artery, runs downwards and laterally, and then winds around the lower border of the popliteus, which it supplies from its deep surface. In addition to the popliteus, it also supplies many other structures, which are popliteus muscle, tibialis posterior muscle, superior tibiofibular joint and tibia, and also interosseous membrane and inferior tibiofibular joint. Now, these were the muscular branches. Now, there are also genicular branches which arise from the tibial nerve. They are 3 in number: superior medial genicular, inferior medial genicular and middle genicular, and accompany the arteries of the same name: superior medial genicular, middle genicular and inferior medial genicular. The middle genicular nerve pierces the oblique popliteal ligament and supplies the interior of the knee joint. Cutaneous branches, it is called the sural nerve. Cutaneous branch of the tibial nerve is the sural nerve and arises about the middle of the popliteal fossa. It runs vertically downwards underneath the deep fascial roof of fossa and leaves the fossa by piercing the roof near its inferior angle. Now, vascular branches supply the vasomotor fibers to the popliteal vessels. So this was about the tibial nerve. Now the common peroneal nerve. The root value of the common peroneal nerve is L4, L5, S1 and S2. It is a smaller terminal branch of the sciatic nerve. It appears in the popliteal fossa beneath the long head of the biceps femoris and slopes downwards and laterally along the medial side of the tendon of the biceps femoris to the lateral angle of the fossa. Here it crosses superficial to the plantaris lateral head of gastrocnemius to reach the back of the head of the fibula. It winds around the posterior lateral aspect of the neck of the fibula, pierces the peroneus longus muscle, and terminates by dividing into deep and superficial peroneal nerves. In the popliteal fossa, the common peroneal nerve gives rise to two cutaneous branches and three genicular branches. The cutaneous branches are sural communicating nerve. It arises opposite to the head of the fibula, and lateral cutaneous nerve or lateral sural nerve. It arises lower down and pierces the deep fascia to supply the skin on the upper part of the lateral side of the leg. Now, genicular branches are superior lateral genicular, inferior lateral genicular, and recurrent genicular nerves. The superior lateral genicular and inferior lateral genicular supply the knee joint, and the recurrent genicular nerve supplies the superior tibiofibular joint. The common peroneal nerve can be palpated against the neck of the fibula, and the common peroneal nerve gives no muscular branch in the popliteal fossa.